Myself Nikitha, Assistant Professor, Department of Nutrition and Dietetics. Today I am going to present on the topic gallbladder disorder. The gallbladder is a small organ where bile is stored before it is released into the small intestine. Human can live without a gallbladder. The gallbladder is a pear-shaped hollow organ that sits just beneath the right lobe of the liver. The gallbladder is a 7 to 10 cm long, 3 cm broad at its widest part and about 30 to 50 ml in capacity. Anatomy includes sections of gallbladder, neck, a narrower part that tap into the cystic duct, body, which is main dilated portion that lies between the fundus and cystic duct which stores bile. Fundus is the last part which is rounded at end of the gallbladder protrudes from the liver. It includes 4 layers. The mucosa, the innermost layer, absorbs water and electrolytes from the bile and secretes mucus to protect the gallbladder. Muscularis, a layer of smooth muscles that helps in contraction to release the bile. Perimuscularis, a thin layer of connective tissue which contains blood vessels, nerves and lymphatic vessels. The outermost layer, serosa, a transparent layer of connective tissue that covers the gallbladder which attaches to the surrounding tissues and organs. This picture depicts the sections of gallbladder. Biliary apparatus. Biliary apparatus collects bile from the liver, stores it in the gallbladder and transmits it to the second part of the duodenum, which includes the right and left hepatic duct, the common hepatic duct, the gallbladder, the cystic duct and the bile duct. The main functions of gallbladder includes the bile storage. It can hold up to 50 ml of bile at a time, and bile concentration. The gallbladder absorbs excess water and electrolytes from the bile, concentrating the bile salts, cholesterol and bilirubin. And the bile regulation. The entrance of fat in the duodenum stimulates the cholecysticonin, which forces to contract the gallbladder layers to release the bile into common duct and finally into the small intestine. The fat-soluble vitamins like A, D, E, K are absorbed with the help of bile. Waste removal. Bile helps in eliminating the bilirubin, cholesterol and detoxification process which eliminates the harmful bacteria from our body. Digestive enzymes like lipase, amylase and trypsin were activated with the help of bile. Fat digestion, which includes the process of emulsification where bile salts break down fats into the smaller particles which increases the surface area for lipase to act upon. Cholecystitis. A cystis means an inflammation. Cholecystitis is the inflammation of the gallbladder, typically caused by the gallstones blocking the cystic duct. The walls of gallbladder become red and swollen. Sometimes pus collects and causes distension. During such episodes, right upper quadrant pain, nausea, vomit and flatulence were seen. There are 2 types of cholecystitis which includes acute and chronic. Acute cholecystitis. Acute cholecystitis is inflammation of the gallbladder that develops suddenly, usually due to the gallstone blocking the cystic duct. There are several types and classification of acute cholecystitis depending upon the various factors. First, based on etiology, calculus cholecystitis caused by gallstone blocking the cystic duct and the acalculous cholecystitis occurs without the gallstones, often seen in critically ill patients and trauma and burns or sepsis patient. And based on pathophysiology, cholecystitis is classified into 3 types. Obstructive acute cholecystitis, which includes the blockage of cystic duct leads to the inflammation, and chemical acute cholecystitis, where the bile leakage into the gallbladder wall causes the inflammation, and the gangrenous acute cholecystitis, where necrosis of the gallbladder wall often due to the severe inflammation were occurred. Chronic cholecystitis. Chronic cholecystitis is a long-standing inflammation of the gallbladder. It is caused by repeated mild attack of acute cholecystitis. This leads to thickening of the wall of the gallbladder. The gallbladder begins to shrink and eventually loses the ability to perform its function. The main etiology includes the chronic cholecystitis occurs more often in women than men, and the incidence increases after the age of 40, and the risk factors includes the presence of gallstones and a history of acute cholecystitis, and vasculitis and low immunity power also cause chronic cholecystitis. Symptoms includes the severe pain in upper and right abdomen, and the pain spreads to the shoulder and back, tenderness over abdomen, nausea, vomiting and fever. These can be diagnosed easily by blood test, imaging tests like X-ray, endoscopic test and CT scan, and HIDA, hepatobiliary immunodiaztic acid, and ERCP procedure, which means endoscopic retrograde cholangiopancreatography. The treatment includes medications which commonly used were chenodeoxycholic acid and ursodeoxycholic acid, which helps in dissolving the gallstones, and antibiotics, pain medicines, and procedures to remove stones like ERCP can be done. And in severe cases, surgical methods also prescribed, which includes the cholecystectomy. Medical nutrition therapy includes in an acute attack oral feeding or stop. PN may be indicated if the patient is malnourished and it is anticipated that he or she will not be taking anything orally for a prolonged period. The low fat diet were recommended and usually 30 to 45 gram of fat per day can be given, and the addition of soluble fiber to the diet may act as a agent and bind to the bile in the stomach between the meals to avoid gastritis. In a chronic stage, patients with chronic condition may require a long-term low-fat diet that contains 25% to 30% of total calories as fat, and administration of water-soluble forms of fat-soluble vitamins may be benefited in patients with chronic gallbladder conditions or in those in whom fat malabsorption is suspected. Thank you.